Welcome to a new episode of our weekly web series COVID-19 Science in Context. Case numbers of Omicron are doubling every 2 to 3 days, and the new variant is expected to take over Delta in the UK before Christmas. I'm Sabine, and joining me today is Professor Azra Ghani. Ezra, what is your team doing now, and what information are you trying to get about this variant?
We're looking at the case data as it comes through, in particular the signs for this particular variant, and trying to match that up to information, for example, on people's vaccine status to understand what the implications are for the vaccine. At the same time, we're looking at how fast it's growing, look at the curves of spread, and then we're putting this into models to understand what the potential implications of this could be.
Early data seems to show that vaccine-derived antibody response is not as efficient for this variant. Can you comment on this?
Yes, certainly what we've seen in the last 24 to 48 hours is what we call neutralizing antibody titers that show that the vaccine will not be as effective as it was against the Delta variant. What is important, though, is that we need to now translate those into what this means for actual protection against both mild infection, but really most importantly against hospitalization.
Does a new variant cause milder disease, and if so, do we still need to worry about it as much?
Unfortunately, we just don't know that yet, because what we've seen is this new variant is emerging in younger age groups, and we know that younger people are less at risk from the severe complications. So for the time being, what we have to do is really to plan for the worst case scenario, which would be that this variant is similar to the Delta variant in terms of severity, but of course we hope it could be milder.
What do we know about the impact of these new measures that have been announced?
Well, the aim in this situation, when so many things are highly uncertain, but we know that the variant is spreading rapidly, is just to try to slow down that spread. That gives us time to better understand the implications of it, but also it really helps us in terms of getting those booster doses out, because we do know that 3 doses now of the vaccines are needed in order to ensure high levels of protection against this particular variant. It will be possible in the future, of course, to adapt the vaccine specifically for this variant, but for the short term, what we really need to do is get as many people vaccinated and protected.